Welcome to the Patient Experience Volunteer Orientation session. This session is divided into 3 parts. This is the part 1. My name is Helena. I'm a Patient Experience Leader at Vancouver Coastal Health. You will meet my colleagues Roloff and Malia in the coming videos. In the 3 videos, we will cover what is patient experience and people-centered care. What is Patient Experience Volunteer Program? And what do you need to know as a Patient Experience Volunteer Program? First thing we would like to say is thank you very much for volunteering your time to support Vancouver Coastal Health. We're especially thrilled that you decided to join the Patient Experience Volunteer Program, a new initiative to support what matters to patients and their care partners. Before we start, I would like to humbly acknowledge that I am an uninvited settler on this traditional, ancestral, and unceded territories of the Coast Salish people of the Musqueam, Squamish, and Tsleil-Waututh nations. Let's open up with a short video about how we all contribute to patient experience. Keep in mind, all of us is or can become a patient or a caregiver. I would like to note, for the purpose of this orientation, patient includes clients, residents, or any individuals receiving care at Vancouver Coastal Health. For the purpose of this orientation, family includes all care partners. It could be the patient's chosen family, caregiver, or support person.
Every time someone walks through our doors, we have the opportunity to positively impact their experience. What you'll do is you'll go around the pole to the elevator.
The experience of the people we care for is impacted by each and every interaction they have with us. From the car parking attendant or security guard, to the doctor and nurse at the hospital, to the receptionist at the end of the line making an appointment, to the community healthcare worker providing care.
Patient experience at Vancouver Coastal Health is what the process of receiving care feels like for those we care for and their caregivers. It's a key element of quality, alongside providing clinical excellence and safer care. It's also about caring for the needs of those who work in healthcare and our communities.
Okay, thank you. A positive experience for those we care for benefits not only our patients, but also their loved ones, as well as our staff and volunteers. Everyone plays an important role in contributing to an improved experience, and the positive ripple effect benefits us all.
We are all the patient experience.
As a volunteer, You are patient experience. Feel free to pause this video and think about what resonated for you in the watching the video. What leads or contributes to the positive experience and care? What values come to mind for you? What resonates with many of us are related to the underlying values of people-centered care. Need for us to feel respected, informed, engaged, and involved. People-centered care is all about relationships and working with rather than working for. It is about empowering our patients and their care partners in managing their health. Vancouver Coastal Health looks to the experience framework to address how best we can support patient experience. There are many factors that influence patient experience at a large organization like Vancouver Coastal Health. I want to draw your attention to the 3 factors circled here: patient, family, and community engagement, environment and hospitality, and policy and measurement. As a patient experience volunteer in this new initiative, you will be playing an important role in our efforts to create a positive, comfortable, and compassionate encounter. You may be the first person who the patient or care partner is interacting with. You are offering the patient and care partners to share and listen in a safe, unbiased way. People-centered care is measured by patient experience. Dimensions of people-centered care include clear information and communication, continuity of care and smooth transitions, emotional support, empathy, and respect, being involved in decision-making and respect for preferences, involved decision-making and supporting care partners, timely access, effective treatment by trusted professionals, and attention to physical and environmental needs. Through our patient experience surveys, we will hear about people's experiences and respond by improving the dimensions of people-centered care across Vancouver Coastal Health. People have said for a long time that seeking medical care is not a safe experience. People experience racism and acts of discrimination that impacts on their experiences in and engagement with the healthcare services. These documents seen here confirms that there is Indigenous specific racism exists on all levels in all areas of healthcare in BC. We know there is racism and acts of discrimination in our healthcare system. We need to change this, and it starts with every one of us. Indigenous cultural safety is an active, ongoing practice of Indigenous-specific anti-racism, cultural humility, and self-reflection. Indigenous cultural safety is an outcome when Indigenous people report feeling that their experience in healthcare are safe and free from discrimination and racism. It is not determined by us. It is determined by the person receiving care. As a patient experience volunteer, we can foster Indigenous cultural safety by focusing on making human connections and approaching people with compassion, empathy, and people-centered care values. So, how can we make someone feel safe and cared for in this complex healthcare system? Well, first, always remember to make eye contact if culturally appropriate. Introduce yourself and smile. Let the people know what your role is and always explain what you're doing. For example, as a patient experience volunteer, we are collecting patient experiences to support improvements at Vancouver Coastal Health. And respect people's wishes if they do not want to participate in this survey. You may have seen this video from the general volunteer orientation, but it's a really good one to rewatch now that you know more about patient experience and people-centered care. Empathy, compassion, and people-centered care are difficult concepts to describe. Let's take a look at this video together. Feel free to pause and think about what resonated for you watching this video. And as well as if you are the patient or care partner, how would you like to be approached by the patient experience volunteer? Take away from part 1. Take the time and approach people with compassion and people-centered care values. Always smile and make eye contact if culturally appropriate. Introduce yourself. Ask permission to engage. Respect their wishes if they do not want to engage. Remember, our patients and care partners are having one of their hardest days in an unfamiliar place. Think about how we would like to be approached or treated. Remember, you're helping to improve patient experience by listening and asking patients and partners to share their experience in what matters to them. This comes to the end of part 1 of the Patient Experience Volunteer Orientation session. Please close this window and select part 2 of the series. Thank you very much for your time.